Employee Assistance Program is a function of Human Resource Department. We offer individual and organizational counseling. Individual counseling is where a person presents with problems such as depression, anxiety, alcohol and substance abuse issues. They also present with problems like family issues. All those problems, they hinder them from achieving their goals in this hospital, or they reduce their productivity. So the work of the Employee Assistance Program is to equip them with the skills that they can be able to manage themselves. We deal with issues of organizations such as the work environment. If where the employee is working is not conducive, they share with us whatever they are going through. So we are able to work together with the department and the HOD of that department to make sure that all the employees in that place are well taken care of. We also deal with sensitizations in various departments. This is where departments call us, especially when they observe the employees and they find that they are either having stress in their place of work or burnout. The role of Employee Assistance Program is to work with managers and supervisors to support their employees so that they can perform to their best.
Employee dependent can benefit from Employee Assistance Program in various ways. One-on-one is one-on-one counseling services. Another one is family therapy, or a group. We bring in the family members to support this staff. So at the end of it, the family will also come in and understand the staff. So the staff will also be respected by the family, will be trusted by the family. We bring them together, we help them, support them together, so all of them are empowered, so they are able to cope and move on with their life situation until that moment the desired change is achieved.
Especially this time of COVID-19. This is a problem that has no cure. So you find that staffs are very, very anxious whenever they find a positive case. Some of the issues that come out are fear, anxiety, and uncertainty. Once they are tested, we make sure they are tested, and when they come back, we are able also to give them support. For those who have symptoms, they are admitted in IDU for a few days, like 3 to 5 days, where they are given a treatment and they are observed. If the symptoms that they presented with reduce, then they are also asked whether they have a place where they can isolate at home, or whether they have a conducive environment at home. And that one is done by the doctor to check whether they can isolate at home. So if they meet the criteria for home-based care, they are discharged home, but we are given the contact to do a follow-up at home. We do counseling, telecounseling, where we reach them even in their homes. We reach them and their family members, get to know whether the family has been tested, and also organize for them to come for testing, get to know how the family is feeling. For those who test positive and they are admitted in IDU, there is always a counselor located in IDU who does counseling for both all the staffs from outside Kenyatta Hospital and those within. So we as employee assistance officers, we pick those telephone numbers and we talk to them while they are still in IDU.
We help employees cope, the ones who are affected by COVID-19, by giving them strategies on how best to keep themselves mentally and physically okay. Stress management, things like physical activities, and also eating well and getting lots of rest.
When a staff tests positive, what happens is that there are people who are working in the testing area, Clinic 66. They receive those results.
At 66, we do give them the results, if they're positive or negative. When they're positive, we give them some ways of how to manage, mostly about health. If they're feeling sick, we tell them to go see a doctor. The doctor will prescribe them something symptomatic. If not, it's to go home and isolate if they're able to. And if they're not able to isolate, they are taken to daycare. After that, we ask them how they manage their stresses, if they listen to music, read the Bible, jog around, walk around, things like that, and also their eating habits, making sure that they still keep in touch with their families if they're isolated, and if they're not isolated, to make sure they are, at a safe distance from their families.
Then from there, the doctor will explain or will do an assessment. Once the person is treated and the symptoms are no longer there, they are discharged. They are only discharged if they have a conducive environment where they can isolate. So that is the decision of isolating at home is made by the doctor. The environment they are living in should be fumigated. So all that is done by Employee Assistance Program to support them at home, as well as those who are in hygiene. We even consult the nutrition department to help us with the diet that we can tell our employees to use. So they say they can take a lot of fruits, vitamin C, make sure when when it's hot outside, they go and bask in the sun, vitamin D. So we liaise with different departments to support our staff. Kenyatta National Hospital has invested a lot in their employees. Health employees will always give health outcomes. I would like to appeal to all our employees at Kenyatta National Hospital to visit Employee Assistance Program when and wherever they have any challenges that may make them not work comfortably. Please pay us a visit. Your life will never be the same. You will come in with a baggage and come out smiling. You're welcome.